It is my pleasure to introduce Anna, who is an indispensable member of the melanoma team. She is our social worker and has been in medical social work her entire career, is focused in cancer at this point, and is going to talk about a lot of the needs that I think we see quite a bit in patients with melanoma and cancer in general.
Well, hello, everybody. It's a pleasure to be here, and thank you, Dr. Fesher, for asking me to come and speak today, and to Dr. Lau as well. So I'm going to talk about psychosocial aspects of cancer and melanoma. I want to say that I have also worked in rehabilitation several years. So when I heard that we were going to have a PM&R doc in the Cancer Center, I was thrilled. And I've had Dr. Smith come and speak to another group that I facilitate. And so while you are here, Dr. Andrews, no pressure, but we've got a melanoma support group now. And so we may be asking you to come and talk to our group at some point. So you've been diagnosed with melanoma. And some of the things that I've listed here are, just really important things for a person who's been diagnosed to do. And one is be an advocate for yourself. And you think, well, of course I am an advocate for myself. But I mean that in every part of your life. When you've been diagnosed with cancer, your life changes dramatically. And not only advocating for yourself in your health care with your doctors, but also in your relationships, in the workplace. And so it's really important to be able to do that. Understand your diagnosis. I think a lot of you sitting in the audience today, you're here, you're very well informed. And that is obviously incredibly important. I have talked with patients who are afraid to know more about their cancer, don't want to know about treatment options, and ultimately it does not do them, that much good. So being educated, being well-informed, being an active participant in your treatment, and then also involving your family and your friends who are support to you, particularly if you're feeling overwhelmed with a new diagnosis or, just new treatment options or recurrence. Again, it's interesting because some patients that I talk to initially may be more reticent to talk to or hesitant to talk to family or friends about their diagnosis. And it really depends. It's an individual decision. Some people are very private. Some people put it out there on Facebook or other types of social media. It's important to do what feels right for you, but it is also important to share this with people that are important in your life so you can get that support. So adjustment to living with cancer. When someone's first diagnosed, it is pretty normal to feel shock, disbelief, and the feelings, however you feel, the anger, all of those feelings are normal. And, of course, managing those feelings are really important. And what I hear sometimes patients saying is it takes time to absorb this. It's sort of feeling that it feels surreal. I hear some patients say that. Well, I feel pretty good. So it takes time, of course. And it works. The important thing is to find what works best for you in terms of how you cope. Having a support network, and I mentioned family and friends that understands what you're going through, helps tremendously. And this can be other people who have a melanoma diagnosis, and I'll talk about support groups. If you decide when to talk about your cancer, and to try to also be as active as you can. Sometimes I'll hear some patients say they want to isolate themselves. They don't feel like going out. They're hesitant to participate in certain activities. They're nervous about how they're going to talk about their cancer, what someone is going to ask them. So look at what you can control. And if you are not upbeat, you're having a bad day, it's okay. Before cancer, you probably had bad days also. And that's about self-care, really. You don't have to be upbeat. And I hear one of the common comments is, I have to be strong. And I often wonder, I think that's something in our culture that we have trouble defining sometimes. So what does that mean, be strong? So you're going to have days that you feel better than others. And the reason why I put filling out an advance directive for healthcare, it takes time and it can bring up challenging feelings. Our healthcare system is really trying to increase the number of adults that have a durable power of attorney. Fairly large percentage of adults don't have one. So if someone comes to the cancer center, that is a question that we ask, and we really encourage that you do one. And because you've been diagnosed with cancer, this also really forces you more to think about your mortality. There are questions in the advance directive that, are pretty important questions to think about and put down your wishes. If you come to clinic and you don't have a power of attorney, we have booklets, and I use that interchangeably. Advance directive for healthcare, it's a power of attorney also that is contained. That's part of the document. And you are appointing patient, an advocate to speak on your behalf in the event that you are not able to make those decisions. So we'll provide the booklet. We've now got it where we on our website. You can download it. And if you want to meet and talk about it, we can do that too. And there's different opportunities in clinic. Our patient navigator, Becky, will ask you, do you have a power of attorney? Your provider will ask, and then also I sometimes get referrals about durable power of attorney. You also need to decide who you want to appoint to be your patient advocate. And this should be somebody who understands your diagnosis, but someone who could also be calm enough and help to make those decisions in a potentially difficult situation. So things to think about. And sometimes the people closest to us and some of our loved ones are not necessarily the ones that you want to identify as your patient advocate. And that's okay. So any further questions about that, you feel free to ask. So managing emotions. Fear of recurrence is not uncommon, and I know that's been discussed this morning. And this is also the reason why I get referrals sometimes. So that fear, what do you do with that fear? Feelings of depression, anxiety, and I also put fear, are very common. And some of these are normal responses to this life-changing experience. You probably all have heard about the fight or flight kind of response. I say that sometimes. That anxiety, there's varying degrees of it, but when it gets so severe that it interferes with our quality of life, it sort of gets turned on to almost overdrive, then it's really important to look at what are some ways I can manage this better. And taking, a drug isn't the only answer to that. Sometimes a combination of things can be really helpful. Depression also, there are different types of depression. And there can be a reactive depression, and this is related to being diagnosed with cancer. And it doesn't mean that you're going to have that for the duration, for the rest of your life. The good news is these are very treatable, and we can help you in different ways. It's not a sign of weakness to talk about your emotions either. It's very important to do that. Sometimes I'll see patients and they're maybe a little hesitant to share with family members or a spouse that they're getting some counseling. And so we talk about that. And it is, I think, recognized more and more that it's really helpful, and it can be healing, and it can be beneficial to sort some things out, to talk to somebody who is not only a professional, but that is more objective. So some coping strategies. I put sleep, move, eat, a proper diet. That's sort of a follow-up to what you've been learning this morning. Follow suggestions and work with your oncologist and team to manage your symptoms. Work with your team to manage your pain. Pain can be demoralizing, and that is why you don't have to be tough. Sometimes our patients will cut their medication in half. I'm afraid of becoming addicted. Or they may not take the prescribed amount. But again, I go back to that whole quality of life, and living with pain can really impact that. So, relaxation exercises, breathing exercises, yoga, guided imagery, art and music therapy. Some of you may be participating in some of these therapies. But the reason why we have these in the Cancer Center is they're very helpful, and they have an impact on your emotional, psychological well-being. So, learning some, breathing relaxation exercises. You can do some simple breathing exercises. Literally, you can do it in the exam room when you're sitting there and close your eyes, or just take some, breaths, breathing in 4 counts slowly and breathing out. You can do that when you're sitting in the exam room and you're anticipating what news am I going to hear. Guided imagery is something that is very effective, and there have been studies that have really shown good outcomes. And I think I mentioned this also further on. It not only uses your focusing on your physical, but also emotional, cognitive, visualizing. So it's good stuff. And we have somebody who is really an expert in guided imagery, Claire Castleman at the U and the Cancer Center, and she is a clinical social worker like myself. So you can check out, if you go to the Comprehensive Cancer Center website, there is a short example and that's Claire's voice, and she meets with our patients all the time. So support groups, peer counselor. I am a huge proponent of talking to somebody who is going through what you're going through. And, there's good evidence to show that people who attend support groups or talk to another peer person who's been through or going through treatment, how powerful that can be and what a positive impact that can have on someone. So that's why we have support groups. And, of course, spend time with people who are supportive and who are good listeners. Can they laugh and cry with you? Now, good listeners, sometimes you just need someone to talk to who literally is just going to sit there and listen to you. They're not going to offer any kind of advice or, something that you really don't want to hear about. And what I say to patients sometimes is, and I'm sure some of you have gotten this, where, I think we're good-intentioned, human beings are, but sometimes that can involve giving some unsolicited advice where they're telling you about some treatment or diet or something like that you've never heard about before, and you really don't want to hear it. Or they're telling you a story about a relative who had melanoma. And so what I would encourage you to do, if that's happened to you, is have something in your head, a response that you can say to people. Thanks a lot, but I'll let you know if I want to hear more about that. Or I appreciate your support, but I'll let you know if I want to hear more later. And sometimes getting some of that information when you're feeling a little more vulnerable too, depending on where you are, it's not real helpful. So, spirituality and religious beliefs can be of great comfort to people. And we actually do have a chaplain in the Cancer Center, and Wayne meets with some of our patients. So additional coping strategies. Counseling, of course, can help to address adjusting to a cancer diagnosis. And I put grief and loss issues in here because we don't always talk about being diagnosed with cancer as being, a loss and having feelings of grief. But really, and that is what happens in a lot of cases. Your health has changed. It's different from the way you knew it, and it's had a huge impact on your life. So those feelings can be addressed, and you can get help with those. If you have children in your life, whether they're your own children, you're an aunt, an uncle, you have grandchildren, the American Cancer Society, that's ACS, supports talking to children in your life using, I said the C word, cancer, and melanoma. Children are tremendously resilient, and what you do is you share it with them in an age-appropriate way. So how you're going to describe this to a 5-year-old obviously is going to be very different from how you talk to a 15-year-old. But what we do know is that if you don't share it, they overhear, they may take misinformation. So somebody they know in school, a relative, or what they hear on the TV, that's their frame of reference, and we know that usually is not good, accurate information. So, learning different mindfulness techniques, I just want to mention that also, in addition to some of the previous things, the relaxation and guided imagery, but mindfulness techniques, and some of you may already do this, it really helps with staying more present in the moment. And mindfulness has almost become like a buzzword now. You probably have heard that out there. But it is very helpful. And it can help with our thoughts when we start to have negative or anxious thoughts. And as well as CBT, which was mentioned earlier, cognitive behavioral therapy. And CBT is really a structured, time-limited therapy that helps us with rethinking when you're having negative or distressful thoughts, how to shift that thinking. Medication for anxiety, depression, and sleep. Those are not uncommon in our population, the cancer population. and can help tremendously. Some people are hesitant to take meds, and some of you may have started to come to the cancer center and you are already taking something for anxiety and or depression. And anxiety and depression is so common in our society, and it's something that when you go through very stressful events, obviously it can be exacerbated, but those can be new problems, challenges for some people. Very manageable, but don't feel like you have to tough it out, or I should be able to pull up myself up by my bootstraps, and why am I feeling this way, and why am I crying a lot? I always say to patients, it's really about quality of life, and if this is impacting your quality of life, don't you want to feel better? So it's good to explore those. And I know that Dr. Fesher and Dr. Lau are really good about talking to their patients about how are you feeling? How's your emotional, psychological health? I put sleep in there because sleep deprivation is something that is just, it can be detrimental for us. Even if you are not going through cancer treatment, if you don't get good sleep, restorative sleep, it really affects us, our functioning, our mood, our energy, everything. So I'm going to move on to financial worries and concerns. And sometimes those can be reasons that keep people awake. So I'm just putting a few things down here to mention that are important. Work benefits. Sometimes I meet with patients and they don't know what their benefits are. They don't have a clue. One of the things where you can take really good control is know what your work benefits are, your short-term disability, long-term disability. What are your benefits, and how much paid time do you have? And so you can plan and think about your treatment and how all of this affects it, and getting to your appointments. Family Leave Act, FMLA, this is a federal law. It's not connected to pay, but it protects your job. There are some certain guidelines depending on how many employers or employees rather your employer has. There's good guidelines on the U.S. Department of Labor website that you can check out. If you're a spouse, if you're an adult child, you also are covered under the Family Leave Act. And our clinics fill out the paperwork all of the time. So it's 12 weeks. Typically you can break that up. You can take it part-time or part days, hours for treatment, appointments, or some people will take it, they may need to take it consecutively. It just really depends on what your needs are, what's going on. And other income sources in your household or with your family. Being diagnosed with cancer, going through treatment, it's very difficult for a lot of people financially. It's very stressful, and so it's important to know what are my options, and some people have better options than others. But we're also here to help you with that. And we have a patient financial counselor. We have our practical, now it's called Patient Assistance Center, and they can help with resources and talking further about these things. When to apply for Social Security disability income. This is a very individual decision, and a lot of times you talk to your oncologist about that. And what's interesting is, I know Dr. Fesher and I have talked a couple times about with some of the positive results we're having with some of the immunotherapies when there's no evidence of disease and someone's feeling better. So where does that factor in? And again, this is a very individual decision, and it has to do with fatigue, what your job is, and sometimes, and many times, I hear patients, they have to modify what they do, their ability to do their job previously. They may have to cut their hours back. They may have to, they may realize, do I really want this same stressful job? Or do I want to do something different? And it's an interesting time for people. So, and this is also where PM&R can be really helpful too. I also think we really need a vocational counselor in the cancer center, so I'll put in that plug because voc counselors work closely with PM&R doctors, and just in that setting, I will refer people frequently to Michigan Rehabilitation Services if they're not sure about how they're going to reenter the workforce. So there is also there's also a great website, Cancer and Careers, which gives a lot of really good information for what your rights are and how you go back to work, the interviewing process. How do you talk to your coworkers or your boss about having cancer? It's a great website. They also have these great free conferences for people with cancer. So anyway, compassionate allowance. If you get to the point where you are deciding you're going to apply for disability, compassionate allowance is a program within Social Security disability, and it has certain diagnoses. Metastatic or stage 4 melanoma is on that list. So if you have that diagnosis, you will qualify for disability. How do I know that? I mean, it's a program within Social Security. It's also supposed to put you on a fast track to be approved more quickly. Unfortunately, it can still take, they tell you, up to 4 or 5 months to start to get your disability pay. Sometimes it's a lot sooner. I've seen or heard some patients say they get it, in a few months. So I talked a little bit about working and can help people at times with structure, routine, and a sense of normalcy. And so it's how we identify ourselves, what we do with our day, and that structure. And it's very important. Again, just how do you talk to boss, coworkers, know your legal rights, and you should, and if you should feel discriminated against, then that is where you might want to check out the cancerandcareers.org. Also, if you are diagnosed with cancer, you are also protected under the American with Disabilities Act. A lot of employers don't know that. There are some companies out there and employers that are not well informed. So this is another, reason know about this, to be able to advocate for yourself. Support system. I'm going to talk a little bit about support systems. So obviously, family experiences the stress of a diagnosis as well. And, sometimes I hear they don't know what to say. How much to help, or they may avoid talking about your cancer, your melanoma. But talking obviously is very important. And you didn't get a dress rehearsal on how to do this, so sometimes it just takes starting to have those conversations, and they may feel awkward at first. And some people are better at it than others. Friends, this is also something that I hear frequently. Some will be there for you, and some will fall away. And I've got a couple of quotes, and it's actually from support persons, and it usually surprises people who is there with you through the long haul and who might disappear. So what is important, though, is to really focus on those relationships that are there with you. And the positive ones. Support groups, I talked about peer counselor, powerful way to feel support from someone you can identify with. And another great peer support online, there's American Cancer Society, but also Immerman Angels is a peer support national organization that's got a huge database. So it's telephonic. So if you call Immerman Angels, one of the founders is a cancer survivor, Johnny Immerman. They'll pair you and to talk to someone. I'm going to talk a little bit about caregiver stress and taking care of yourself. This is for caregivers. And to take care of yourself so that you can stay healthy physically and emotionally. It's important to speak out about your feelings while being sensitive, obviously, to the feelings of others. And again, this takes practice, right? And sometimes you're going to say things that are going to feel awkward. Or the good rule of thumb is to use I statements rather than you. Also makes people feel less defensive. Care burnout is a very real thing and very real problem. And so caregivers sometimes feel guilty. I'm not the one with cancer. So what am I complaining about? And some people then will let this build up and build up. And that's not healthy for you. Some caregivers describe feelings like they are on an emotional roller coaster. So when you are a caregiver, here are some additional suggestions. The National Cancer Institute Caregiver Bill of Rights. Check it out. Great. And what I like about this is it really gives caregivers permission to take care of themselves. Take time for yourself. Schedule it in every day if needed. And this should be as important as anything else that you are doing as a caregiver. And learn some form of relaxation. You can see I'm a big proponent of breathing exercises. I think I've had that in there several times. Ask for help with chores, shopping, transportation. Have a routine. Talk about your feelings. Consider a support group for caregivers. And there are a lot of them out there. Words for caregivers. These are a couple quotes I thought, that really describe it, how people feel. And this is Rhonda. She said, we've gotten lots of support, and some of it comes from people we expected it from. But a lot has come from those we don't know very well. And others we do know well have stepped away. You just never know with people. And Brian's mom has always been the rock in the family. Now it's almost as though we're the parents and she's the child. It's hard because we have our own children to take care of and jobs to go to. So it's kind of that sandwich generation, as they call it. And this was one, I have no idea what the penguin signifies, but I thought this sort of summed up kind of the roller coaster that people feel. Couldn't focus at work, thinking about finding best treatment centers for my dad's cancer. Dad called about exciting promise of a treatment being offered to him locally. So relieved that I still can't focus at work. This is a Maya Angelou quote. If you find it in your heart to care for somebody else, you will have succeeded. Living with uncertainty. And this actually is about those of you who have cancer and caregivers as well. What helps you not to think about your cancer at times? So, what brings you satisfaction, pleasure, joy? Having hope. It's okay for this to change from day to day. If you have days when you struggle with feeling hopeful, talk to someone who supports you. And again, learning some mindfulness techniques such as staying present in the moment can be very helpful. Guided imagery, and another plug, check it out on our website. 5 questions. I don't know how many of you may know Atul Gawande, but he actually is a surgeon and has seen many cancer patients. And these are the 5 questions that he asks a lot of his patients. although in his comments, and it was a little bit too long to put in my presentation, he says, these are questions that we all should be asking ourselves. It shouldn't just have to be the doctor asking this. And I think it's wonderful that he does ask his patients about this. So ask yourself this: if you Google 5 questions, even if you don't remember a tool, Gawande, it'll pop right up. It's all over the internet. So, and these are kind of good questions to ask yourself. What is your understanding of where you are and your illness? Your fears or worries of the future, your goals and priorities. What outcomes are unacceptable to you? What are you willing to sacrifice and not? What would a good day look like? And this is just one of his quotes, which I really liked. So, you may not control life's circumstances. And we can plan for our lives, can't we? But we really can't control a lot of our circumstances. But getting to be the author of your life means getting to control what you do with them. Here are some ways that you can build your sense of hope. Now, some of these I know, and some of these are taken off of the national, the NIC, National Institute for Cancer website. You plan your days as you always have done. Don't limit the things you like to do just because you have cancer. Look for reasons to have hope. And spend time in nature. Reflect on your religious or spiritual beliefs. Listen to stories about people with cancer who are leading active lives. Dr. Jerome Groopman wrote the book, The Anatomy of Hope. And this is one of his quotes, which I thought was, I really liked and wanted to share with all of you. He talks about it being a central emotion, and we are often at a loss when we are asked to define it. What does hope mean to you? Many of us confuse hope with optimism, a prevailing attitude that things turn out for the best, but hope differs from optimism. Hope does not arise from being told to think positively or from hearing an overly rosy forecast. Hope, unlike optimism, is rooted in unalloyed reality, so clear reality, right? And then this is another short quote of his. Hope is the elevating feeling we experience when we see, in the mind's eye, a path to a better future. Thank you.